I have my practice at Bushland Beach Medical Center. It's called MYTOOTHDOCTOR. We have other locations as well at Aitkenvale, at the Aitkenvale Family Health Center. And we also have an institutional client, which is the Townsville Aboriginal and Islander Health Service, where we see a number of patients with special needs. One thing quite unique is that a lot of people come in a wheelchair, and whilst I was teaching at JCU, I saw this huge chair and I said, what is this for? And my boss then, Professor John Abbott, said, oh, it's a bariatric chair and it converts into a wheelchair platform. And I said, well, where can I buy one? Because I'm setting up this practice and I need one. Well, apparently it's from the UK and you have to import it directly. So to get it TGA approved went through a lot of a rigorous process. So my practice now has the same equipment as what the university has, and it's being used on a more regular basis. So it's basically a chair. So if a person's bariatric, a lot of patients are afraid of seeing their dentist because they might break the chair. But we sort of reassure the patients that, look, this is an environment where you can sit in the chair and you don't have to worry about breaking it, and then we can recline you safely. Now, for people on a wheelchair, sometimes it takes away the dignity of the patient when you need to hoist them out of the chair and put them in the chair. So we tell them, let's remove the bariatric platform and just wheel into the chair, and then we just tilt them back. So it allows you to treat the patients more comfortably. But you also have to add in other equipment other than just the chair alone. So you might need a portable x-ray, or you might need some other portable gear, because some patients may require a general anesthetic. So if you are doing a general anesthetic, you should be able to bring your gear into theater and deliver the same service as what you would in your dental practice. When you say accessibility, you have to look at access and the ability. So access is, yes, you have the equipment, yes, you have the staff, but are your staff trained to handle the patient from the minute they walk down the door? It should be a welcoming environment.
It's important to spend the time with the patient and develop a relationship with them and rapport, because at the end of the day, that's what will make them want to come back and see us again. You want them to have the best experience. You want them to feel like they've gotten their money worth as well. I just put myself in their shoes and how I would like to be treated when I go to any sort of appointment. Everyone is different, everyone has different requirements and needs, so it's important that they know exactly what is being explained to them, and so we take the time to make sure that they're fully aware of what's required and what's needed for their dental health.
I think it boils down to training. So it starts with education, and then from there we could then show other practitioners that it is possible to achieve and deliver culturally appropriate care for people with disabilities. It should be timely, first and foremost, and it should be clinically appropriate.